When you ejaculate, your body goes through a mini workout. Heart rate and blood pressure rise briefly, then return to baseline as you return to rest. During orgasm, your brain releases a cocktail of feel-good hormones, notably dopamine, reward. When you ejaculate, your body oxytocin, bonding, and endorphins, pain relief. These chemicals help lower stress by reducing cortisol, elevate mood, and promote relaxation. Many men report feeling calm or even sleepy after ejaculation. This mood-enhancing, stress-relieving effect is well supported by medical sources. Physically, ejaculation helps clear excess seminal fluid and reduces pelvic congestion. The prostate and seminal vesicles continuously produce fluid. Regular orgasm flushes these out, which can relieve discomfort. A 2016 study observed that healthy men who ejaculated daily for 2 weeks experienced a temporary drop in semen volume and sperm concentration, but no decline in sperm motility or DNA quality, indicating no long-term harm to fertility. Pros of daily ejaculation. First, there are emotional benefits. Daily orgasm raises dopamine and oxytocin, helping reduce anxiety, enhance mood, and support sleep through raised prolactin after climax. Many experience easier sleep and less stress, a natural, safe way to unwind. Next, pain relief may occur due to endorphin release, while mild cardiovascular exercise during sex supports heart health. And some studies even suggest improved immune response after regular sexual activity. Third, prostate health may benefit. Long-term observational research, such as a major Harvard study, found that men ejaculating 21 plus times per month had a 31% lower prostate cancer risk than those with lower frequency. While not conclusive, it suggests frequent ejaculation may help purge potentially harmful substances from the prostate. Other advantages include improved intimacy for partnered men, maintained pelvic muscle tone, and better understanding of one's own sexual responses, valuable for both solo and partnered sex life. Cons and cautions. Daily ejaculation may slightly reduce sperm volume and concentration per release, especially if ejaculations are back-to-back. While healthy men quickly recover capacity, those trying to conceive may optimize success by spacing ejaculations typically 1 to 2 days before and during ovulation to ensure a full sperm load. Energy and convenience can also matter. Frequent sexual activity takes time and physical stamina. If other life demands are high, or if you feel persistently fatigued, daily ejaculation may add unnecessary strain. Minor physical downsides include skin irritation or soreness, particularly from aggressive or dry stimulation. Simple solutions. Lubrication, gentler technique, and short rest periods usually resolve these issues. Another important consideration is psychological. In rare cases, daily ejaculation can become compulsive, where individuals feel unable to control the urge, neglect other areas of life, or experience distress. Such patterns may indicate underlying issues like anxiety or addiction, and should prompt a visit to a mental health professional. Long-term health implications. Hormones and testosterone. Many fear frequent ejaculation lowers testosterone, but reliable evidence shows no lasting impact. Testosterone fluctuations after orgasm are brief and return to baseline. One Cleveland Clinic urologist asserts that masturbation has no long-term effect on testosterone levels. Masturbation or sex may slightly boost testosterone transiently, but the overall hormonal balance remains stable. Erectile function. Contrary to myth, masturbating every day does not cause erectile dysfunction. Healthy men maintain erectile function even if they ejaculate daily. In fact, sexual activity can promote blood flow and tissue health, beneficial for maintaining erectile resilience. Psychological factors, not frequency, more often underlie erectile difficulties. Fertility. As mentioned, although sperm concentration drops slightly with frequent release, overall fertility remains intact for most men. Semen production adapts, and doctors note that daily masturbation does not impair fertility, especially if no underlying sperm issues exist. Prostate and cancer risk. Accumulating evidence suggests frequent ejaculation, especially 21 plus times per month, may reduce prostate cancer risk by about 30%. While this doesn't mean daily ejaculation guarantees protection, it counters the misconception that frequent sexual activity increases risk. Regular flushing of prostatic fluid may contribute, but more research is needed. Precautions and when to seek help. Most men can ejaculate daily with no issue, but certain situations warrant caution. Men with serious heart conditions should check with their doctor before resuming frequent sexual activity, as orgasm can mimic moderate exercise and raise heart rate. If ejaculatory pain, bruising, unusual discharge, or scrotal swelling occurs, seek medical advice. Early attention can prevent complications. Watch for signs of compulsive behavior, such as inability to stop despite wanting to, secrecy, declining performance at work or in relationships. In these cases, mental health support may be beneficial, especially if there's guilt, anxiety, or shame around the behavior. If you're trying to conceive, spacing ejaculation to boost sperm count around ovulation is effective. And as with other aspects of health, regular check-ins with a trusted healthcare provider can help tailor advice to your personal health needs. Age, lifestyle, and relationship factors. Age. Young men, 20s, 30s, often have libido and stamina for daily ejaculation. As men age, 40s, 50s plus, testosterone and sexual response naturally decline, so needs shift. Ejaculation may take longer, and recovery may slow, but remains healthy and can preserve tissue health. Lifestyle. Fitness, balanced diet, stress management, and good sleep support sexual health more than ejaculation frequency. Exercise boosts testosterone. Obesity, lack of sleep, and smoking impair libido and erection quality. Ejaculating often is a part of healthy sex life, but living well is the foundation. Relationships, solo or partnered, frequency doesn't define a healthy sex life. Communication with your partner is key. Consensual sex should feel comfortable for both. Masturbation on off days can help maintain desire and reduce frustration. Debunking common myths. Let's clear up some persistent myths. You'll run out of sperm. Wrong. The body continuously makes millions of sperm daily. Ejaculation doesn't deplete your supply. It lowers testosterone. Unfounded. Long-term levels remain steady, unaffected by masturbation frequency. It causes erectile dysfunction. No evidence supports this. ED stems from other causes: vascular, neurological, psychological, not ejaculation habits. It drains energy. You might feel relaxed after orgasm, but this is temporary. Frequent ejaculation doesn't weaken men long-term. It causes mental illness. Masturbation is a normal sexual behavior. Guilt or anxiety stems from cultural or personal beliefs, not from the act itself. Health problems result from frequent masturbation. Claims like prostitution of eyesight, insanity, or infertility are myths. Science supports masturbation as a safe sexual outlet. Urologists and institutional resources like Cleveland Clinic, Mayo Clinic, and Harvard Health affirm that regular masturbation is generally harmless and often healthy. Ejaculating daily is safe and often beneficial for most healthy men, emotionally harmless, physically safe, and potentially helpful for mood, sleep, and even prostate health. It does not harm your hormones, fertility, or sexual function. The occasional dip in sperm count clears quickly, and time-tested advice suggests spacing ejaculation only if trying to conceive. Still, if ejaculation becomes compulsive, painful, or distressing, it's wise to pause and seek medical or psychological guidance. As always, sexual health thrives alongside overall wellness, good sleep, stress management, fitness, and open communication with partners or doctors. In short, a urologist would say, if it feels physically and mentally fine for you, daily ejaculation is absolutely normal. Live comfortably, safely, and enjoy a healthy sex life, whenever and however often that suits you.